Bismillahirrahmanirrahim. Hello folks, my name is Dr. Mohammed Rashid Siraj. Currently working as a consultant, minimal invasive and bariatric surgeon. I am currently working as a consultant surgeon and a professor of surgery with Farouk Group of Hospitals. I've done my fellowship from Pakistan, and also I have taken the master degree for Royal College of Edinburgh. I am also a diplomate of minimal invasive surgery from Strasbourg Institute in France. I have delivered lectures on minimal invasive surgery and attended several courses throughout the world. And currently I am providing my services and consultancy in Farouk Hospital, both of their branches, and also I'm a part of Contours Obesity Management Center in Gulberg, Lahore. I have the privilege to be the part of the team who started the bariatric surgery in Pakistan way back a decade ago, almost in 2007. And we started it with the gastric banding surgery and introduced it first time in Pakistan. And right now we are doing almost all of the bariatric procedure, including sleeve gastrectomy, gastric banding and gastric bypass, and recently we have also started minimal gastric bypass here. Besides that, my specialty is advanced laparoscopic surgeries, the common procedures like laparoscopic cholecystectomy, hernias, appendix, and the rest of the procedure. We also specialize in the laparoscopic gynecological procedure, including ovarian cysts, hysterectomies, and other surgical procedures. Talking about the bariatric surgery, actually it's a weight loss surgery for the treatment of obesity. In Pakistan, obesity is one of the main disease which has prevailed for the last so many years because of the sedentary lifestyles of our community. So there's a misconception that the liposuction and tummy tuck are the obesity surgery. They're actually the body contouring surgery. Bariatric is proper weight loss surgery. There are two types of bariatric surgery. One is the restricted one and other is the malabsorptive one. In the restricted type, we just restrict the intake of a patient. And in the malabsorptive, we make such changes in the anatomy of the patient in which the whole food he or she takes get malabsorbed. It's not properly absorbed, and so eventually leading to the weight loss of the patient. For the last few years, the bariatric surgery has also been promoted as a surgery for the treatment of metabolic diseases like diabetes, hypertension, and other hormonal associated problems. So nowadays it is also the main standard or the gold standard treatment of diabetes type 2, in which weight loss is also suggested to the diabetic patients. As far as the surgical procedures are concerned, initially when the patient comes for the consultancy, we get his or her total investigations done, BMI and other dietary habits. We take a detailed history, and then if he opts for the surgery, then we put him or her on the very low caloric diet. This is VLCD, to just prepare him or her for the surgery. It takes almost 2 to 3 weeks for the very low caloric diet. Then according to after taking the detailed history, we just opt a procedure and discuss it with the patient that what is the best treatment for amongst all the options of the bariatric, whether it's a candidate of sleeve gastrectomy or gastric bypass or gastric banding. Then we optimize the patient for at least 3 weeks, then we go for surgery. Surgical procedures are almost a daycare procedure which takes almost 1.5 to 2 hours in case of gastric banding and sleeve gastrectomy, but it's a lengthy procedure like a 4-hour procedure in case of gastric bypass. It depends on the patient to patient, the procedures vary. There is not a fixed standard. There are multiple factors on which it all depends. Some patients are a good candidate for gastric banding, and the others, we have seen a patient who have got a very poor compliance for bandings, and then we give them an option for sleeve gastrectomy or a gastric bypass, and it all depends, it all varies, but we take a very thorough After a very thorough session of a discussion with the patient, then we go and give the option of the surgery. Talking about the side effects, there is no surgery which haven't got any side effect, but in a skilled and competent hand, we can limitize them. But still, like if we talk of the gastric banding, there is always a chance of slippage of that band, and it can perforate into the stomach even. It's a foreign body, so there is a foreign body reaction. There's always a chances. And in case of sleeve gastrectomy, there is a high chance of sleeve leakage of the sleeve, and sometimes patients don't lose weight after the sleeve, and there is chances of vitamin deficiency. So some of the patients have to take lifelong vitamin. We suggest them. Nutritional deficiencies are obviously side effect of all the bariatric procedure. In this case, if the patient keep in touch and pays frequent visit to a doctor, generally these can be avoided. And obviously there is a proper learning curve of all these procedures. We have spent almost 5 to 7 years in just learning these procedures, and with repeated, and it's a team effort. So naturally the complication can be squeezed down or lessened by your skills and by a proper compliance of the patient. Generally people do come and ask this question very anxiously, that what exactly the weight loss after surgery. Again, I suggest that it's all varies on the type of procedure you perform. And obviously, let me tell you one thing, that bariatric surgery alone is not going to help you out throughout in the process of losing weight. Obviously, the patient has have to also to put his input by walking, by restricting the diets which we forbid or which are forbidden to take in while you have gone through the bariatric surgery. And it's the compliance. Our patients have, we have few patients who have lost almost 50 to 70 kg or 100 more pounds in 6 or 8 years, and there are patients who have just lost 10 to 12 kg in 6 months. So it all varies. But generally, if there is a proper compliance of the patient and they are ready for serious follow-up and becoming even sincere with them after getting through this procedure, this is the only solution of obesity right now. As far as the success rate is concerned, again, I would say that it varies. We have got different group of patients. Generally, patients have responded very good. And in case of sleeve gastrectomy and gastric bypass, patients generally lose 6 to 7 kg per month, and at the end of the year or 6 months they have lost a significant amount of weight, the desirable weight, and same goes for the gastric banding. And the most serious point, obviously, the cost in Pakistan is still cheaper than rest of the world. At cost, it starts almost from 5 lakh and it goes up to 7 lakh. It's a daycare procedure. Generally, we keep the patient for 24 hours in the hospital. He can resume the normal activity after 24 to 48 hours. And with serial passage of time, he or she started losing natural weight, which we suggest should be around 7 to 8 kg, because beyond that, weight loss would cause weaknesses. And the recovery is almost uneventful. We haven't seen any particular complications regarding the recovery. Few of the patients do feel nauseating and vomiting feeling for a few days, and because there are certain metabolic changes going on after the surgery, but they do settle with time. As I have said earlier, the idea of bariatric surgery is to optimize the diet of the patient, and people do come across a question that what we are going to eat afterward. What we suggest them that basically these surgeries are meant to restrict your diet. So still the beverages, the food and the beverages containing excess of carbs and fats and that junk food, they should be avoided, because the weight loss would be there certainly, but the process of weight loss and the speed of weight loss would be low if you take these things along with the diet. So the strongly contraindicated things are these fizzy drinks and the drinks containing more of the sugars and the fat, and the junk food and the carbs can be squeezed down. We suggest to take more of the proteins and veggies after these procedures. Yeah, there's a common problem that people do come back to us that we are not losing the weight or the desired weight. At some time they have also complained of even regaining weight. Let me tell you, like we talk of sleeve gastrectomy, there's always the chances of dilatation of the sleeve. If you put more burden on the remnant stomach, obviously it's elastic tissue stomach and it's going to get dilated again, and the patients are going to gain weight even after. So it's a common phenomena, but you have to align your life on a proper direction after going through bariatric surgery. People do gain weight after gastric banding because they regain their habits and re-switch to the previous habits before the surgery. So it's my advice that if you are going through this bariatric procedure, then once you have lost weight, you have to mend it by your own self. But the idea is to put you back in your normal shape once you were before the obesity, and once you regain it with this bariatric procedure, we always suggest to modify your lifestyle patterns, modify your dietary habits so that you don't regain weight. But there are always chances of regaining weight after bariatric procedures. Being a consultant bariatric surgeon, I suggest to all my patients that it's better to adopt a lifestyle which don't push you to a point where you have to opt these procedures. Instead of going for these procedures, you must, and especially the younger generation who are more prone to these sort of foods and sedentary lifestyles, they're always suggested, and the parents are always suggested to take care of the diet of their children, especially when they are going to schools and outings, to focus on more on the healthy diet than instead of more carbs and fats, because they're not going to do any good with your body. So it's better to stay slim and in a proper shape than to opt for these procedures. That's what I suggest to my patients.